Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.
Now, down to your questions. Can Gabriel tell me what causes red spots with white heads? They come and go. I have them on my head or body. So it's red spots with white heads on them.
Yeah, they sound like general acne, to be honest. You know, that where the white head is a pus or that's built up from bacterial infection locally. So with the come and go, it could be related to some transition in the body. That's for instance, there's a type of acne that will get worse prior to menstruation. In the week before, and then after flow they're grand then for the next 2-3 weeks, and then they come on again. So that's hormonal acne or linked to the hormones. So if they're coming and going, again, after a full consultation it becomes clear exactly what they are, but that'd be my guessing that it sounds like a form of acne.
Okay, listener wondering, can you recommend anything for high blood pressure? Now, the lady I was talking to, her told me she is on medication as recommended by her GP, but it doesn't seem to have taken it down. Is it safe to take something else if you're already given?
I definitely would. I'd do my very best to get it down for sure. And for some people, it takes sometimes to be on 3 different type of blood pressure medications, and then still need to add in lifestyle recommendations and herbal medicines as well. I mean, it's important to see a medical herbalist when using herbal medicines along with the pharmaceutical drugs for something like this. But definitely, very high blood pressure is dangerous, and it shouldn't go on for long periods of time. But generally, they work on a few different ways. Is one, reduced volume of fluids in the body, so you might get prescribed a diuretic, which increases the amount of urine you excrete from the body. And if anyone's prone to water retention, either in the ankles or anywhere in the arms and so on, that can also increase the pressure in the system. So there's drugs that do that, and there's herbal medicines can do that. There's general antihypertensive herbs, but lifestyle and diet are very important here as well. If it's something that all of us, it was grand generally over the years, and all of a sudden now it's sky high, I'd look into environment. Some people, I see it more increasingly now, with they're sensitive to wireless technology in the home, and a groundbreaking study published just a year ago in a mainstream medical peer-reviewed journal on that cordless telephones. We have a wired telephone.
Yes.
Wired, and then now what's very common is a cordless one.
So you can wander around the house while you're talking to someone, or
fits into a cradle. You can take it out and walk around. That can. There's people who are sensitive to that and can induce irregular heartbeat, but also induce hypertension. Now that's kind of a long shot, but be aware of environment if it's just spiked. But definitely, one should lose weight. Straight away, it'll have benefits on blood pressure. Increase exercise. Straight away it'll have benefits on blood pressure. And the threshold isn't that much. It's something like if you do a 15-minute walk every day or something, straight away you're going to bring it down a couple of points in the diastolic and the systolic and stuff. There's certain things in the diet. Watch the stimulants, caffeine, alcohol, sugar. All these things can increase pressure in the system. One could be sensitive to sodium. It's actually quite rare. A lot of people think it's very common, but if so, they need to really take down salt content big time in their diet. And the likes of high dose fish oil, omega-3s, will bring down blood pressure, and herbal medicines. So a mixture of all, but I definitely work on getting that down. Yeah.
Okay, this listener had a biopsy yesterday. The biopsy was off their stomach, but they're in discomfort today, they're sore and feel sick. Is there anything that they can maybe take to calm that down a bit for them, or is it just sort of go through the motions until it does itself?
Yeah, well, I guess if they had an endoscopy with biopsy, they may have been fasting for a couple of days, and sometimes when we fast, and there is therapeutic fasting, I do it myself, but it should be done under guidance, but you can feel unwell for a period of time, a number of days and that, and it's really toxins kind of coming out of the system. Now, not to say that that's this in this case, but I'm just assuming if they just have a generalised feeling unwell, I mean, contact the person who done the procedure for sure, just in case it's relevant. But a few things would be, I'd make sure you're hydrated. I mean, as you fast, and generally before colonoscopies and endoscopies, people are given this, anyone who's got one will know what I'm talking about. They're given this drink. It's a kind of a laxative or purgative, and it's terrible stuff, but that will actually dehydrate the system. And that can give feelings of unwell. So make sure you're well hydrated and get a lot of liquids back in, and also get some foods back in. Maybe, when one's breaking a fast, even a 3-day fast, one shouldn't kind of break the fast and jump in and have a big steak and stuff. They should really eat lightly for 24 hours and then back into normal routine. So all of them may help.
Right. What would be a normal reading for somebody on warfarin, a blood thinner? No, I'm not sure what they mean by that.
The normal reading of their bloods.
I presume that's what it means. I'm not sure.
They go on, it's a full blood count you get, and they generally check them every month or two, depending on how long one is on it. I'm not too sure exactly the reading, but they've been marked on the blood results. I'm sure your GP will relay it to you.
Exactly.
And also check liver enzymes, I think, when one's on blood, warfarin.
Okay, could Gabriel recommend something for an 80-year-old lady with reoccurring bladder infections?
Yeah, I can. Diet, I'd every day, twice a day, have about 40 mils of pure cranberry juice. And pure cranberry juice is tart, but I'd if you want to add dilute it with water and so on, but definitely I'd have that a number of times a day, and that's a dietary recommendation. Internally, I'm going to be given herbal medicines that are urinary antiseptics and just urinary tract tonics in general. It's very common actually for elderly females to have recurrent urinary tract infections and cystitis. It's a common thing, very well documented in the medical text, but I've read clinical trials that have shown really good positive outcomes with introduction of cranberry juice. I use herbal medicines, Zea mays, cleavers, golden seal, and a few others. All of these are really good urinary tract tonics. And to do with nutraceuticals, there's it's a sugar, but it's given as a supplement. It may be available out there. D-mannose, and it's shown in clinical trials, very safe, but it's shown in clinical trials to largely reduce recurrent cystitis, urinary tract infections. Okay,
now this caller has an inner ear infection, and after 6 weeks of antibiotics, it hasn't shifted. They also have a problem with sinus leading to nosebleeds. Any tips, or will she need to go to an ENT consultant as recommended by the GP?
Well, if the GP recommends seeing a consultant, I would. And, I think if you get a referral from a GP too, it speeds it up. It speeds up the time that you have to wait to get to see the consultant.
Okay. Now, any cure? Ask Gabriel, is there any cure for tinnitus? What is tinnitus, firstly?
Tinnitus is a ringing in the ear or a buzzing in the ear or so on. It can take the form of even white noise. If you Margaret, knows radio, and knows that it's just like a shh. It can be a beep, or it can be a ringing, and it can be intermittent, it can be constant. And with that, if you think about it, there's a whole myriad of other impacts on quality of life if it's constant, and that includes some people can't sleep with it and so on and so on. It's a very difficult thing, and I see a lot of people for it, and I have varying levels of success in how to respond. But what I use is ginkgo biloba, in that there's a bit of science behind it. There's nothing in the pharmaceutical realm really either for tinnitus. It's just one of these things that tends to be higher in musicians and say tilers and people who did a trade with loud noises all their life type of thing, and it can come on after a trauma too if someone gets an injury, a head injury. But if they increase the circulation to the inner ear, to the area, that helps it, and in some people it can go away. So this is documented, and that's why I use ginkgo biloba, a standardized extract of it that is proven to increase cerebral circulation, so circulation to the head and to the brain and the middle ear, and some people find that helpful.
Okay. A woman that has, it just jumped to me. A lady that has the flu the last week, she went to the doctor, she's on a cough bottle and tablets 1 to 3 times a day, but there's no change. Can you recommend anything to shift it?
Yeah, well, I mean, with flu, immune system is low, and there's loads of immune system. This is on a herbal medicine base. There's loads of immune system tonics can be really good, but also antivirals. So I combine them. I'd formulate a medicine specifically for flu, and some of our best antivirals are elderflower, echinacea, tabibua, golden seal, wormwood. These are all antivirals, but also antimicrobials, if there was a secondary bacterial infection. But with flu in general, get the immune system up. So vitamin D is of vital importance here, and this is why I'm thoroughly convinced we have a flu season in the depths of winter. Now it's colder and darker and so on, and that'd add to it. But the reason we have it there and not in the summer is I'm solely convinced now with the research that vitamin D plays a massive role, and it's very important for Ireland. So I take a supplement, vitamin D supplement, and get things out of the diet that hamper your immune system, and that's high sugar diets and processed foods.
Okay, I had a stillborn last Thursday and have a pain in calf of right leg for the past 2 days. Should I get it seen to?
Yeah, I get an ultrasound, or no harm to get some testing done just to see how things are internally. Okay,
finally, can you take cranberry juice if you have high blood pressure?
Yes.
You can do. Okay, we've lots of questions, and apologies to our listeners. As always, we're inundated with questions, and we always hold them over. And if you haven't heard your question answered this morning, then certainly when Gabriel's back in 2 weeks' time, we'll pass them on to him. Gabriel McSharry, medical herbalist and nutritionist, thanks a million for joining us on the programme this morning.
Margaret.
Rejoin me, Ocean Life, just after this break.
Ocean FM. Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.